the Robert Wood Johnson Health Policy Podcast Series, the interview series with the nation's leading experts in health policy. I'm Dr. Chileshe Nkonde-Price, and our guest today is Dr. Nicole Lurie, Assistant Secretary for Preparedness and Response at the U.S. Department of Health and Human Services. Welcome, Dr. Lurie. I'm so pleased you could join us today.
I'm delighted to be here.
I'd like to start by asking about current events, specifically the week of April 15th. The Boston bombings, West Texas, ricin. Could you share with our listeners the role and response of the Office of the Assistant Secretary for Preparedness and Response?
Sure. Well, the week of April 15th was obviously a big week for us too. And one of the things that you should appreciate is that that occurred against a backdrop of this new bird flu in China, H7 and 9.
Right.
And so we've been preparing and leaning forward in case that were to turn into a pandemic situation. Mm-hmm. So we're frantically at work planning, getting ready to make vaccine, making a set of decisions, and we're sort of emotionally ramped up, I would say, when this happened. It also happened not long after another mass tragedy, which was Sandy Hook.
Mm-hmm.
And so that also really primed us for thinking about a set of issues in terms of mass casualty events and in terms of psychological health that might not have happened otherwise. So our office is responsible for helping the country prepare for and respond to all different kinds of events, whether naturally occurring like hurricanes, or like the things that Mother Nature gives us, a pandemic, or man-made things like a bombing, like ricin. Right. And so one of the things I think that was so important about that for us is that we have defined a set of core capabilities that we think that every community should have to be ready for public health emergencies, whatever it is that comes their way.
Okay.
And in that, we believe that if you can do those core things, and they're common across all different kinds of emergencies, we call it all hazards planning or capabilities-based planning, that if you can do those things, then you've got the agility and the mental space to deal with the unique circumstances of any event.
Right.
And think about how to pivot and respond to whatever it is that comes your way. Now, it's not very often that all of this happens in 1 week, right? And that was a good stress test for us, is what I would say. And I was really proud of our team and really proud of our country because we handled the whole series of things. Flu, Boston, ricin letters, and West Texas, I think all really well. Yeah. And although the Boston bombings and West Texas were a bombing and an explosion, were urban and rural, what we saw was that those same set of capabilities applied to both, and that our communities were in a much better position to execute a response to both, regardless. And we also saw that issue about the core capabilities playing out.
Wow.
So whether it was the healthcare system preparedness, distributing mass casualty victims across different healthcare institutions so none of them got overwhelmed, having a communication system in place so the public would know what was going on, being able to manage the volunteers, the role of first bystanders, the role of mental health, all of those things played a role in all of those events, and that's so important.
I'd like to delve a little deeper and ask, how do we think about the health implications of these events?
I think it's a great question. And one of the things I think I've learned over the time that I've been doing this job is that almost all events are health events.
Right.
And even if they don't impact directly someone's physical health, particularly the sort of blood and guts aspect of it, that the American people have health worries and concerns that have to be addressed. This was the case with the Deepwater Horizon oil spill. It was the case with the Fukushima accident. It's the case with ricin, that people have all kinds of health worries and concerns, and that those need to be addressed no matter where they are.
Mm-hmm.
And if you get in front of people's health worries and concerns, you're in a much better position to address them. You know, it was interesting. So the immediate response to the bombing in Boston went, by all accounts, very well.
Right.
That Friday, when the manhunt was underway and Boston was locked down, I actually happened to be in Boston, so was locked down with everybody else.
Mm-hmm.
And I have to say that that was sort of a mental health event for lots of people, right? It wasn't that anybody was getting hurt at that point, but lots of people were worried and concerned, and we had to find ways to address their fears and help them stay calm.
Right.
One of the things for me that was interesting is that we do a lot of monitoring with social media to understand people's concerns. And the levels of fear and anxiety that we saw through social media that Friday exceeded the level of fear and anxiety that we saw the rest of that terrible week, even the day of the bombing.
Wow.
And so the idea that knowing that we could start to get ahead of that with messaging about how to help yourself stay calm when you're on lockdown, how to help your kids stay calm, limit exposure to television, those sorts of things, really important kinds of information. But almost any event is, from that perspective, a health event.
Right.
And health and public health needs to be at the table as we think about preparing for them and responding to them.
Okay, and that really leads on with what I was going to ask you next in terms of what are the policy implications. Can you give us some policy lessons learned?
Sure. Well, first is that every event is a health event, and health always needs to be at the table. Secondly, each one of these is a great reminder that the public health system and the medical care system are not like trains on parallel tracks, never to meet, but need to come together.
Right.
And I think those events demonstrated the important ways in which they did.
Okay.
Third, as we talked about at the beginning, that we have to plan for all different kinds of events, and these one-off plans don't help us.
Right.
But having these core capabilities that we have rehearsed and practiced are really important. Fourth, I'd say that preparedness and response are built on the back of strong day-to-day systems. And I'm always saying if you can't do it every day, you can't do it on game day.
Right.
These responses relied on the back of strong day-to-day systems to detect an event, whether it was the bombings or ricin, to very quickly determine whether there were other harms, knowing that there were not biological agents or chemicals dispersed. In contrast to West Texas, knowing that this explosion was also a hazmat event, and you had to do that early detection and protection of people. They were all mental health events, so that all hazards capability planning is key, and that frankly the mental health components are part of any event too. In each of these, you have to think very early on about what's the transition to recovery going to be.
Okay.
Right? And be able to help the community be in a place to take back the responsibility for this and transition to recovery and resilience as quickly as they can. I would also say none of these things happen by themselves. You need to have the strong day-to-day systems in place, and you need to practice. You need to drill and exercise. And people forget about that. Those drills and exercises help you do better with day-to-day events, but unless you have plans in place, unless you have personnel who know how to do them, unless you have a culture of bystander response, and these events, first bystanders in both Boston and West saved lives.
Right.
Those are all very important. That doesn't happen without money.
Right.
And as we have seen tightening federal, state, and local budgets, one of the things that's been on the chopping block is money for preparedness and response. Now, we don't have to spend as much time buying stuff, but we continue to need to drill and exercise. We continue to need to have a public health infrastructure that is in place and intact.
Right.
In the last several years, public health on the ground has lost about 45,000 jobs. So I have a lot of anxiety about how we might go into a potential flu pandemic with 45,000 fewer people on the ground than we had in H1N1. We need to be much more creative and efficient about doing things.
Right.
But this doesn't happen without a strong infrastructure in place. And between events, people take that infrastructure for granted. During an event like what we just saw happen in Boston,
Yeah.
with bystanders, EMS, emergency care, the trauma care system, the public health system, the mental health system, all working together, that just doesn't come from thin air. It has to be in place and robust day to day for things to happen.
Okay. I have a simple question for you. There's been discussion and debate as to whether we were well prepared, whether communities were resilient enough for these events. What's your opinion?
I think what I've seen in this job is that every day around the country, things happen. There are chemical spills and communities have to evacuate.
Mm-hmm.
Sadly, there are shootings
Mm-hmm.
and schools have to go on lockdown. There are these bigger events that capture the national attention.
Mm-hmm.
And it appears as though we did a lot better than we would have done a decade ago.
Okay.
We still have a long way to go. In the big scheme of things, Boston is a very medically well-endowed community,
Yes.
and they handled this really well. What if it were 10 times as many people? How would we have done? I don't know.
Right.
If we look at Hurricane Sandy, New York did pretty well,
Mm-hmm.
but there were a lot of struggles because it wasn't something that people were as prepared for as they might have been. And because the population density was so high, you saw all kinds of things that people were caught off guard by a little bit. You know, high-rise buildings that were out of power for weeks at a time with medically frail people in them, people who had to go to these mass shelters. And the city and the communities did a great job,
Mm-hmm.
but had this been of a larger scale,
Right.
how would we have done? Had there been simultaneous events, how would we have done? And when the people who responded to all of these turn over and there are new people in place, you lose that community and institutional memory.
Right.
And so the resilience building and preparedness activities are the between times way of keeping those things going.
Right. I'd like to switch gears and ask you about next steps. Specifically, if you could give advice to the scholars or researchers who are interested in this area, from what we have learned, where are the new areas where we need to learn more, where the research needs to take place?
There are so many areas, and coming at this from a researcher, that's a pretty easy question. So one of the things that's been, I think, fun for me in the most recent events is to try to figure out how to get a more real-time sense of what is happening.
Mm-hmm.
So whether it's analyzing our electronic health records from the National Disaster Medical System
Mm-hmm.
to be able to pivot our response more quickly, or looking at CMS claims during and immediately after an event to get a handle on what's going on in our communities overwhelmed. Getting a better system in place for knowing, how's the healthcare system doing? Is it overwhelmed? How would we know in real time would be great. But I think more importantly, understanding what does resilience mean?
Mm-hmm.
How do we build it? What are the factors that predict post-event recovery?
Mm-hmm.
And how can we position our communities before and during an event to recover faster are really, really important issues to focus on. What is the role of social media?
Right.
How do you sort out signal from noise?
Mm-hmm.
How do we get a culture of bystander response? There are so many areas where research is needed.
Right.
And then particularly, how do we get our populations and our communities that are less resilient, that might be more vulnerable from one perspective or another, engaged in this? So whether it's non-English speakers or families where the only English speaker is a child,
Right.
how do we think about children as assets rather than always as helpless victims, and what are the ways to do that? How do we think about all of our electricity dependent people,
Mm-hmm.
and what are we going to do to make them more resilient and less vulnerable in a disaster? So lots and lots of things. And I think also for clinical scholars, thinking about themselves, if they think they might want to be involved in responding to some of these kinds of events, it's not something you can just drop everything and do.
Right.
So whether it's responding in a medical sense, you need to prepare to respond, and you need to have signed up with the National Disaster Medical System, non-governmental organization, to even be involved in a response. And then if you wanted to do research and event, what would you need to do to be involved beforehand? How would you be poised and ready to go? How would you have a protocol and an IRB approval worked out? How would you have a research network worked out if you don't know where something in the country is going to happen? Those are lots of questions to ask and answer, but worth having scholars break new ground on.
Wow, so many interesting questions. Now we're about out of time, Dr. Lurie. Before we go, do you have any closing remarks for our listeners?
I would close my remarks with a couple of just personal things. One is that the opportunity to work for the American people, to be a doctor not only for my community but for my country, has been just such an honor and a privilege, and so fulfilling in every way. And to be able to take what I have learned from medicine, from public health, from being a clinical scholar as a researcher, and being a clinical scholar as a change agent for our healthcare system and public health system, and bring them all together has been absolutely tremendous. And you all are the change agents in the next generation of leadership for how our healthcare system and our public health systems are going to evolve. So it's an incredible gift, and use it well.
Thank you.